I've had 3 parents call me in the last week, and they're not quite sure why they're calling me. They're looking for speech and language or occupational or physical therapy for their child, and they're unsure what to do. And one mom, we had a long conversation, and I shared with her my knowledge of the IEP process, my knowledge of what her son needs. Her son's about to turn 3, and the knowledge of the ins and outs of what she needs to ask for her child and how she needs to go about that to make sure that her child gets what they need from the very beginning, because it's so hard to correct an IEP that doesn't include all of that when a child turns 3. And the mom was very appreciative, very receptive, but the conversation to me was super enlightening about what I love to do and what I love to talk about. And the conversation was so encouraging to me of this is what is such a big deal to me, because the system is designed to move kids through, but there are ways to make the system be helpful for every child, but you have to know the system well enough to make it work for your child. And then you have to know the pieces of like, okay, that's a limitation of the system, and I can't go beyond the system. I have to go outside, or I can't push the system to be different. I have to go outside the system to get what my child needs. And
What
a
does it
great
look like to go outside of the system?
Yes, good question. A great example of this is children who have a medical or muscular issue within their mouth and it's affecting their speech production. That's a great example because in the schools, as an SLP, you are not allowed to touch children's mouths. But in a private practice, in a medical setting, you can physically touch their mouths, go in their mouths, stretch and manipulate the muscles and do what's called myofascial work there, or you can do oral motor exercises, which clinically are debatable, but I personally have seen a lot of progress with my patients over the years with that. And I think about it with like pediatric physical therapy. If a child's not walking, sometimes you need to train their muscles. If a child's not talking, sometimes you need to train their muscles, is what I would say is the clinical basis for how I get there. If you go towards ASHA, you'll find tons of information, but that's just what I would say personally as a clinician. And so that's an instance where I want to encourage parents. The system is not going to help you here because your child practicing a movement they cannot make with their physical mouth in its state is not going to change unless someone gets in there and addresses the muscle weakness or the lack of muscle activity or whatever that is. And you need to go seek medical speech language pathology outside of a school setting. So that's a great example to me of ways that I actively encourage parents of like, sure, we can see your kid in a school 4 times a week, but if your child's tongue doesn't move the way it needs to, that 4 times a week is not going to correct what they need from a outside private-based speech language pathologist.